Hello, everybody. Good morning. This is Brandis Montgomery. I'm a doctor of physical therapy and the owner of On the Move Massage and Physical Therapy in Metro Atlanta. And I am bringing a new video to you today to discuss all things related to back pain diagnoses. So, when we go to the doctor, a lot of times we're sent home with these big words that are scary and sound terrible, and we don't know what to do with them because we aren't explained or given an explanation of what that might mean when we're in our doctor's office. A lot of times they're, sort of rushed and trying to get in and out of rooms sometimes, or we forget to ask the questions. And then we leave scared because we've been given this diagnosis of degenerative disc disease or herniated disc or stenosis, arthritis, these big scary words, and we don't know what they mean. So I wanted to spend some time today going over our diagnoses that are most common for back pain and kind of what that really means to you. And then we'll talk about how physical therapy can really help with these problems. So the first thing that we're going to talk about is discs. That's the most common thing. We either herniate discs or we bulge them. And to give a quick explanation of what a disc is, in between each of our vertebrae, so we've got vertebrae look like this. This is the part of our spine we can feel, and then we've got sides that come out and the middle section, and they stack on top of each other. In between each vertebrae, there's a disc, and it's like a jelly, squishy area that keeps each vertebrae from cramming into one another and helps disperse the forces that we put through our spine as we do any activity. Even just general gravity pressing down on us puts forces through our spine. So we've got discs to help protect that. They're squishy and protective. So that's what a disc is. We can herniate a disc by part of that center of the disc coming out into either our spinal cord. Sometimes it presses onto our nerves and it gets in the way. And that's a herniation if it actually comes out from the center of the disc and presses into an area it's not supposed to be in. We can also have a disc bulge, which means part of the disc is bulging out, but it's not herniated yet. It hasn't come out from the center of the disc, it's just pressing out. And so that's like your first step is a disc bulge. A herniation is worse. However, although these can cause a ton of pain and symptoms that you don't want to deal with, they are very curable. I can't even count how many people come to me and say, I have a herniated disc. And when I say, well, when did you herniate it? They're like, 1964 when I was in this car accident. Okay, well, great. Well, if you still have a herniated disc from that car accident, then we have other problems because discs heal. Research shows that typically 3 to 4 months for them to heal, around about 12 weeks for them to heal, given that we take the appropriate steps to allow healing to happen. So we may have a herniated disc for our whole life if we don't ever take care of the reason why we have a herniation. However, that should not be very common. We shouldn't just live our life with like a herniated disc that's always there. And allowing healing to happen means maybe we are practicing a different type of posture. So if we have like a very slouched posture, then maybe we're practicing staying more upright to take the pressure off the disc. Maybe if we have a job where we bend a lot or sit a lot, there are different things that we can do to adjust what that looks like when we're bending and sitting so that we're not putting pressure there. If we have a job where we're picking up and lifting heavy objects, again, we can work on the technique and the form of that, as well as strengthening of our core and postural muscles to help us complete these different tasks so that our spine is not being strained to do them. We have lots and lots of muscles around our spine called our core that help us control and put stability around our bones and our joints. And we want to make sure these muscles are strong and that we know how to use them. So that is something that we can do with physical therapy, and that would be huge in healing disc issues. Next, we're going to talk about degenerating discs and joint disease, right? We hear sometimes you'll get a diagnosis of degenerative disc disease or degenerative joint disease. And although that sounds very terrible, I don't even know why we use that word disease when we're describing it. And I don't know why doctors don't explain that. Like, you don't have a disease that's going to carry on throughout your body or is not something you can heal or take care of. Although we cannot reverse the whatever degeneration has happened in your joints and in your discs, we can help prevent it from getting worse going forward. So what that would look like is, again, we go back to those ideas of like finding what it is that's causing pressure or strain on the discs and the joints, and we help stabilize with strengthening. We help work on muscle control, learning how to use your muscles, and postures that help take strain off of that area. So you can prevent it from getting worse, and you can prevent it from being a daily problem for you. So you don't have to live every day in back pain because you know how to take care of it. And those are things that with physical therapy, we teach you different strategies called joint protection, and you learn how to not put strain on your joints by using different muscles or different postures or different techniques to do, let's say, lifting a heavy object, for example. And that's really important to learn how to do those things so that when you're going through life, you can kind of alter the way that you've done them your whole life, and you do them with more control and more stability around your spine. And then another one that we're going to talk about is osteoarthritis and osteoporosis. Osteoarthritis is the most common, and everybody's got arthritis. At some point, we will have some sort of arthritis. It should not be super scary because we degenerate as we age. Our joints get less fluid or lubrication, I should say, between them, and so it's more closely bone to bone. When we get bone to bone, we get inflammation of the joint because now the bones are rubbing on each other or pounding on one another, and so those areas can become very inflamed, and that's what arthritis is. Anything that ends in an itis is inflammation of, and then arthritis, osteo would be of the bone or the joint. So that is what arthritis is, and although it can be scary and it can be very painful, it can be very limiting for function, it is not something that should stop you. It shouldn't keep you from progressing in life or enjoying life. It is something that we need to get a hold of, learn those protective joint strategies to take pressure off of the joints, learn how to strengthen your muscles and be active and be strong so that those joints aren't always bothering you and limiting what you can do in a day. And then osteoporosis can be a little scary. I understand that could be a little bit scary because that is when we have it's like brittle bones in a way, so it's very easy for our bones to fracture. It's most common in our spine, but it can be in different areas of our body. And when we have osteoporosis, we have to be very careful that we don't put increased forces on our spine that could fracture them. And even as a physical therapist, when we are told that you have a diagnosis of osteoporosis, we have to be very careful about what we do as well. So it's important that we know if you've been diagnosed with that, and you'll find us asking when your most recent bone scan was to see, is it getting worse? Is it staying the same? Are they giving you an injection or supplement to help kind of ease that or take off how fast it's degenerating? And then we can, again, go back to that idea of strengthening, trying to work on different joint protection strategies to help you not put strain on the joints. And then they're usually happier there. So the moral of the story is strengthening, postural and core control, learning how to use your muscles, and also being very aware of your postures and your techniques that you're using when you're doing things throughout the day so that your spine isn't being put through all the strain. We have so many muscles around our back and around our core that help us with these things. We just don't know how to use them a lot of times, and or they're very weak. So we need to strengthen them, and then we need to teach our brain how to turn those muscles on when we're doing things throughout the day so that our spine, poor spine, gets a breather. So if you've got more questions about this, or if you'd like to set up a consultation so we can talk about what you specifically have going on in your spine and see if physical therapy is something that will help you, you can reach out to me via posts on Spotify or YouTube. You can also go to my website and schedule for that consultation, and it is on the move, mpt.com. And I would be happy to give you more information about it and help you in any way I can. Have a great day.